So puberty, so it's a natural part of everyone's life. It happens at different times, and for each person, and the body uses like a lot of different hormones. We talk about primarily estrogen, testosterone, the boy and girl hormone. Boys start around 9 to 14 years of age, and girls is a little earlier, 8 to 12. Okay. And that just shows you boys is on this side and girls is that side. So both genders are making testosterone and estrogen, but obviously boys are making more testosterone and girls are making more estrogen. And then the stages right here, it's more for the physicians who are doing a physical exam and how we kind of grade how puberty goes along with basically 5 steps. Okay, so this is kind of our 8, 9-year-old girl, and this is kind of our 13, 14-ish and up, okay? So changes that are happening, the breasts get bigger, right? You get armpit hair, you get pubic hair. I know, it's not really. You just get a little bit wider, so and you're taller too, okay? So all these changes are happening, and it's not like one day you wake up and your body looks different, but because those changes happen over time and in different orders, it's not gonna be like this all at once, okay? So the most important thing is that as your body's changing, you have a great relationship with your mommy's here with you guys talk to each other, right? Letting her know when things are changing, and if you have questions, asking her or asking your pediatrician, okay? So, the way that I learned it in school, the way that I like to tell my girls, I kind of do this at the 9-year-old well check if I have a good rapport with my patient, or at least by the 11-year-old well check. We talk about the stages of puberty, okay? So it goes boobs, pubes, then tubes, okay? That's the order that it goes. First thing that happens is your breasts change, okay? So I'm so giggling, I love it. the other crowd. So when camis that have the little shelf bra in there, or when you play sports, you're wearing a sports bra, it feels uncomfortable. A lot of girls will tell me I started wearing a bra because when I wore a shirt, I felt uncomfortable and I wanted to put something in me. Okay, so that's the first thing that usually happens. Second thing is pubic hair. Okay, so where is that? That is under your panties area. Or your armpits, you find hair growing there, okay? And then the third thing is your period that happens. Well, you get a growth spurt, so you get taller, okay? Girls get theirs before the boys do. So there's this weird time in like 7th grade where the girls taller than the boys. It's great. Yeah, right, good, right? And then when that happens, the next step is your period, and Dr. Jenkins will be talking primarily about that, okay? The other thing that happens is acne. So hormones, the estrogen coming up, you get acne, so you can get big spots in your face and your back. We'll talk about that. We'll talk about body odor. So wearing deodorant. You probably noticed already maybe that the boys in the class smell. So you know that that's happening already, right? Okay. Boys, so other things that can happen, or your voice can change, okay, because your hormones are changing, so your voice is, there's a vocal cords in here, there's muscles here, your voice can change. Eyesight can get worse, okay, so maybe you didn't have glasses, and now when we do our eye exam, you might need to be wearing glasses now, that's okay, it's part of growing up. You're more likely to get sprains and injuries when you play sports as well. So as you're getting taller, your bones go first, and then your muscles and ligaments are straining to get there. So we're stretching really well before you exercise and after you exercise. Warming up and warming down is very, very important, okay? Because you can get injured more when you like to do it. A little box diagram of like when before puberty and after puberty. So you're getting clothes in the morning. Maybe before you started changing, you could wear the same shoes, the same socks or the same pants. Right now you have to change your clothes every day because you have to, maybe you didn't shower every day. Now you do have to shower every day. If you wash your hair, maybe your hair's a little more greasy, maybe your skin's a little more greasy. You used to only have hair on your head, now you have hair everywhere. And also, it's kind of a side note, but it is very important as well, because I spend a lot of time with my girls during the facility there. Things can get more complicated in your friends group, okay? So maybe before you all played, you had your 2 best friends, and you like played your games, and you had your thing, and then now people are talking about boys, and liking boys and stuff, and there's more drama. So it happens, and just be aware of that. Okay, well, and then I don't know, Charlie Brown, they gave a new movie, right? So, because you guys are really young, so you don't know the old Peanuts, but the new Peanuts movie came out. It's Pigpen, so if you can smell yourself, then you know to begin with something already. This is another plug to bathe. Hygiene, so like I said, you might be sweaty, you might not have like gone running or anything like that, but you might notice that your clothes are more sweaty, like in the armpits area or something like that. You just have to change it. And then your scalp, like I said, might become more oily, so you have to wash your hair more frequently. Okay? Again, wear clean clothes every day, shower, bathe every day, and then talking about deodorants, I had a couple of moms ask me, what deodorants are best or antiperspirants are best, but just know that deodorant is just for smell, but antiperspirant is for sweat. So if you notice that it's wet under your armpit, then you need something that is antiperspirant. But if it's just smell, then you can pick anything, and then I know they have natural ones like Tom's and other brands like that, and stuff like that, okay? Menstrual hygiene. Okay, so this is kind of you guys in terms of ages, but menstrual hygiene. So sometimes when girls have their periods, they get a little bit self-conscious that maybe it smells and maybe it's different. Okay, and just so you know, don't be self-conscious about it. Every woman goes through it, and it's not actually noticeable by other people. Okay, most important thing is just to keep yourself clean, keep yourself healthy. All right, and just bathe every day, change your clothes. You don't need to have any of the scented pads or tampons or anything else like that that you use for your periods, because I don't want you to be putting anything there in a sensitive area that could irritate your skin, because it really doesn't need to be masked. Okay. Body hair. Okay, so this is another big thing. So you will get hair maybe more dark on your legs and your armpits. And just know that the body hair, you can either do something about it or you don't have to do anything about it, okay? So some girls shave their legs, some girls don't shave their legs. You can do other things like waxing and stuff like that. There's no medical reason to do any of that though, okay? So if you start noticing it, I don't want you to be self-conscious. You're all beautiful young ladies, okay? And just know that once you start doing that, you kind of have to keep doing it, because the hair grows back a little bit thicker and a little more coarse. So it's a big commitment to start shaving and stuff like that. So you have to talk to your mom about that, all right? This is kind of the same thing, like hair. Acne. Okay, so most people will have acne at some point in their life. It can start with puberty as the hormones are coming up, okay? So acne, usually what people notice is they'll just be spots on their face, and they can be either like white dots or black dots, or they can be red, and they can kind of hurt when you have them. And they can be in certain zones of your face, like around your nose or in your forehead or in your cheeks, okay? There are a lot of over-the-counter things, meaning things that you can buy at Target or in the store. You don't have to see a pediatrician like me for. But if it gets kind of out of control, or you've tried using things that your mom buys at the store, you can always come to me as a pediatrician. I can help you treat it as well, okay? Oral hygiene. Okay, so basic things. Please brush your teeth. I have to ask every patient this. Brush your teeth twice a day and floss, okay? The #1 infection in pediatrics is actually cavities, and I'm not a dentist. So that doesn't change when you become, when you go through puberty. What changes is that you become more busy and there's a lot of other stuff going on, and you sometimes forget to brush your teeth. One of the other things too that I like to talk about is sleep hygiene. So as school gets a little bit harder, you have more homework, you have more extracurriculars, we all have cell phones, iPads, or things like that. Sleep hygiene is really important. So as your body is changing and growing, you actually still need a lot of sleep. So making sure that you're getting 8, 9 at least hours of sleep. No TV, iPad, laptops, anything in the room with you 30 minutes before you go to sleep, because that light actually makes your brain think that it's still daytime. And it's hard to go back to sleep. Okay, so those rules are very important. Yeah, I have a lot of patients who say they fall asleep watching TV or listening to music. That doesn't actually help. It actually makes it harder to go to sleep. Okay. And then last but not least, body image. So most important, again, all those things that we talked about will happen at different times for different girls. Okay, even in the same family, I have a lot of patients who maybe started breast development at different times in their sisters did. Okay, so most important is that you don't compare yourself to other girls. Okay, what they're going through or what stage that they're at. The key is to be happy with who you are and let mom know exactly what the stages are and what's going on. There's a predictable kind of order of things, all right? And if you ever have questions, you can always bring it up with the pediatrician and bring it up with me if you're one of my patients, okay? And I'm not actually going to do questions. I'm going to send it over to Dr. Camden.
So I just wanted to say hi. I'm Dr. Cranky and I'm an OBGYN. So I'm going to talk about the menstrual cycle and just kind of a brief overview about it and then specific details and kind of bring this whole talk together because I think this is a topic that a lot of people, a lot of young girls have a lot of questions about. So I hope this will be informative for you, okay? So, sorry, just this one? Yeah. Okay, so we're going to talk about the menstrual cycle, okay? Oh, can you press the video? Yeah. So we're just going to do a segue, just a quick fun video before we start, okay?
Hey, it's up! I'm so happy you're here. I've been waiting forever.
Oh, hey, sweetie, how's it
Well,
going?
can I call it though? I've been searching for the miracle womanhood, and all I found was this white crusty stuff. There's nothing miraculous about white crusty stuff. And I'm pretty sure I have enough of you by my Kotex for my first period. Let's do this!
I'm actually here to see your sister. I don't think you would spot me.
You should be the one spotting me. Spotting, can I show you something?
Listen, I will see you pretty sort of kind of soonish, so bye.
So,
Wait, how soon?
so pretty much, we'll go back down. All right, thank you. So we're going to talk about your menstrual cycle, or there's lots of euphemisms for it. One, a visit from your Aunt Flo, right? Menses, period, and many, many more. But your menstrual cycle is one thing. It's when your body changes and it gets to that point where you actually have blood that comes out of your uterus and then it gets on your pad or underwear. And I want to prepare you for that time because that sounds scary when I say that, right? It's not a scary thing. It happens to every woman, okay, at some point in their lives. And that's the reason why we want to talk to you before it happens or if it happens to you recently, okay? So the first thing is your menarche, which is the first time you have your period, okay? So it usually occurs between 10 and 15. However, it can happen earlier, and I can tell you from personal experience, I scared my mother because I started my period when I was 9, and she didn't think it was possible that I was sick, but I did. And that doesn't mean that's a bad thing. I was an outlier. So if you do have your period earlier than the average age of 10 to 15, that's okay. But if you have questions about it, that's when you need to go to your pediatrician, your mom, okay? Any person that you trust and you have questions, and it's okay that this happens, okay? So, your menstrual cycle, okay, when it becomes regular, we're going to talk about that. It's something that happens every month, okay? So every month you're going to have a menstrual cycle, all right? So we're going to talk about that. What does that mean? So we talked about all the changes that were happening, breast changes, the height, etc. Usually the menstrual cycle will start after 2 to 3 years after you develop. Okay? So when your boobs start getting a little bigger, 2 to 3 years on average, you have your menstrual cycle. The average in the US for a young girl to have their period is actually 12.4 years, so when they're in middle school. A little older than you guys here, okay? So that being said, 90% of girls usually will have their period right before they turn 14. So even if you don't have your period by the time you're 1.4 years, okay, about 90% will have it right before their 14th birthday. So your periods, when you first get it, it's not mature. It will take time for it to become regular. It takes about 20 cycles on average for it to become regular. So 20 cycles, that's almost 2 years before it becomes regular. So when you first start your period when you're so young, you're very regular. You're going to have your periods every 30 days, 60 days, nothing for 6 months. That happens, okay? And that's okay because the ovaries to the brain. It isn't tough yet. It's not mature yet. So you have to give yourself that time. Okay, so it's okay not to have your period every month when you first start. And that's a normal thing. So, a cycle is how long your whole monthly period is. Okay, so a normal cycle, if everything's it's like 20 to 30 days. That is on average, yeah, most women have 20 to 30 days, 32 days for a normal period. However, some women have it shorter. So anywhere from 21 to 45 days is actually normal. So some women are lucky and they have a longer cycle, which is great, okay? But to understand that it's okay to have not exactly every month on their first and then have a period. That's actually very unusual. Most women will kind of average out like that, okay? So let's talk about your period and what exactly happens, okay? So day one is the first day of your period. So that's the day that you might have spotting, okay? Have a little bit of blood on your underwear, so it kind of triggers you, you know, I should put a pad or a tampon. And if you have that for the first time, you should go tell your mom or your aunt and just say, hey, I have something on my underwear. You don't know, it kind of feels weird, like I've never seen anything on underwear, except maybe some white stuff sometimes, which is also normal, okay? And when you see that blood on your underwear, or, you know, you take a shower and you see something coming down your leg, it's okay, you're not dying, I promise, okay? But you need to tell somebody that's happening, because it's not going to stop right away after you wipe or something like that. It's going to keep on coming. So the reason why is you have something in your body called the uterus. Okay, girls all have this. Okay, that's the uterus right there. Okay, and then you have your tubes and your ovaries. Okay, the uterus is used for when you get pregnant. Okay, and that's where the baby goes. But that's not your time yet. So you have periods. Periods. So every month we have this period where the lining inside the uterus will shed. And when it sheds, you have bleeding. And this happens when we become regular, usually every month. And it's a healthy thing to happen. So don't worry about the bleeding. Okay? And then we're going to talk about what usually happens. So you have the first day of bleeding. And usually during that time, okay, the bleeding occurs, and then it occurs because there's nothing that happens after ovulation. And ovulation is just a fancy word for when an egg is released by the ovary, which is something all girls have as well, which is something too usually. All right, so let's talk about how long periods. Periods on average are about 3 to 5 days. However, some girls might have 2-day periods. That's okay. And throughout your life, your period will change. You can have lighter periods, you can have heavier in the future, but that's a pattern that you will note. So usually it stays pretty much the same unless they come bed happens. Example, after you get pregnant, your period usually changes after that. So periods is to understand that not everybody's period is the same. Because I know you're going to talk to your girlfriends and you're going to be like, did you start your period? You're going to have questions because everybody kind of has it. And you're going to ask, did you use a lot of pads? Did you use a lot of tampons? How many days did you bleed for? Nobody's answer is going to be exactly the same. Okay? Everybody's different, and that's okay. That's what makes you unique. That's why you have different hair colors. That's why your eyes are, and that's great. Okay? So, the times we, as pediatrician and as OB/GYN, we usually worry about is after you establish your period. So after you've had those 20 cycles, and then you don't have your period for 3 months. That's a time I would recommend coming to the OB/GYN or your pediatrician to say, hey, my daughter has had her period for about 2 years, and they were normal for the past 6 months, 9 months, but now she hasn't had her period for 3 months. I don't know why. And that kind of helps you to come in. Okay. But if within that first 2 years, if they have a regular period, that's okay. All right. I always get that question. Okay. So, what should you do when you have your period? you already came to puberty event, so great. Make sure you ask questions, okay? Any questions you have, you can ask your mom. You know why? She went through this, okay? She knows. She went through it. She knows. She has so much information to give you. She knows. She's going to give you the best stuff, all right? So if you have more questions, okay, and your mom's not sure, or there's something else going on you're not sure about, that's when you come see us. Okay, we can answer those questions for you. You know, why your periods are longer than the average person? Why is it lasting more than 7 to 8 to 10? You know, or it's having half a month. Why is that? That's not usual. That's when you should come and see us. To see why your periods are lasting so long. Okay? So now, what do you do when you have your period? Right? I talked about pads and tampons and all that such. So let's talk about that. We have pads and tampons. I'm going to show you guys what pads and tampons are, okay? So first thing, let's talk, I have the Kotex ones, which is also listed in the video. So, and these are small pads and liners. There's all kinds of different ones. So this one, you can see, there's no wings or anything. Wings are things that come on the side, they can hold and they put on your underwear. There's a little sticky area in the back here. So it sticks on your underwear so it doesn't move anywhere. Isn't that great? So it doesn't get under pretty underwear because you want to throw away this when you want to get on your underwear. So this is a pad, okay? This will catch the blood, okay, when you have your period. I usually tell girls, they always ask me, wow, how often do I need to change it? Well, it depends on your health, how much bleeding you're having. Most girls change it in average 2 to 4 hours, sometimes 6 if your flow is really low. But usually when you use the bathroom, and you use the bathroom quite a few times a day. So when you're in the bathroom, I usually, say change this. So this is a pad, okay? And you have different thicknesses, you have different lengths, and like I said, wings or without wings. We both don't recommend the scented ones. It doesn't do anything. It actually can cause irritation to the genital area. So I usually say non-scented is actually better. If you smell down there, you should check your pads more often. And also, we talk about this hygiene, take a shower, clean yourself, okay? All right, the next part is tampons. All right? Tampons, oh, this is a yeah.
I know, it's brand new.
So tampons are a little different. They're very useful for somebody that's really active. If you're a swimmer, for example, and that's something you can use. But tampons are safe to use with adult supervision. So if you are interested in something like this, I want you to make sure it's okay with your mom first. Okay, but we're going to talk about what this is, and we're going to talk about how safe and everything is to use, okay? It's not for everyone, but I want to show you guys, okay? So this is a tampon with an applicator, okay? So it comes out with this plastic, it's just nice and clean, okay? Yeah, sure. So tampons are something that is inserted inside the vagina, an applicator. Right, you see it right here, and it has a little string so that when you're done, you can remove it, okay? So what happens is when you place it inside, you actually push it, and it comes out, and this is the tampon here. This is tiny little thing. This is actually a medium size, just kind of like, medium flow. And it goes inside the vagina, and it actually will expand to the size of the vagina, and it will catch the blood, okay? The thing about tampons that we used to worry about was something called toxin, which is something more, your mom probably heard about, your parents actually heard about. It's not as common now because super absorbent tampons are no longer in the market, most of them now. So you just have the regular one. The important about the things, the same thing with tampons and pads, is to change them. So when you use the bathroom, just take it out, okay? When you use this, you have to know how to use it. You have to be at the right angle. It does not cause any problem with any parts of the vagina, like the hymen. You just have to do it correctly. And I have a lot of active girls that see me because they want to know about tampons, and their moms are nervous. So I've had those visits before to teach how to use tampons. There's nothing wrong with it. It's not for everybody, but how it goes now, girls are so active and they want to be swimming, the whole month. They want to do that activity. I know there's swimmers or cheerleaders and everything like that that can't wear think education when it comes to tampon is the biggest thing, because it is fine to use. It does not cause any problems if used properly and removed properly. And that's something we do teach all girls. Okay? Apart from that, there's other products and that you can use, but usually those are the two I talk about. Okay. I think I have another slide about pads and tampons. Oh, that's it. All right. And any questions you guys have afterwards, we can talk about that. So, I always kind of approach this towards the end of the subject because I know you're here for your daughters and everything, but it is important that beyond your adolescence, after being teenagers, that you do protect yourself, okay? And then to teach our young girls that their health is part of them too, that they have to be empowered to be checked and to take care of themselves. I think this is the time to begin because they start changing at a certain age where they question a lot of stuff. But this is the time where you know what? You need to take care of yourself. It's okay that you question things, but your health and your well-being is so important. And it continues well beyond, your college years. It's when they become, partners, they get married, and they become mothers, okay? It is so important to understand that they apart from coming to the pediatrician, they will transfer to me. And a lot of times when they start going to college, they have a lot of questions at that time, and they get tested and they make sure you start getting your pap smears, and then understanding what your cycles are. Understanding that if your cycles are not regular, it's something that you can come and get that checked to make sure your cycle is not so heavy. Because if you're bleeding, 7+ days a month, that's not normal. There's something we can do about that. We want you to have a very successful life, and you can't be bogged down if you have really bad periods and things like that. So make sure you come in when you see it. And I say that for young girls, but I also say that for my moms. If you 1 week of the month, it shouldn't be like that. You should get lighter. It should not keep you from your day-to-day life. So a few changes that are really important. I talk about really low women, so all those things, family planning, etc. But a few changes. PAPs are now every 3 to 5 years. I say 3 years more than 5 because there is more rigorous testing that's more specific. That's just for HPV. So I do tell all my moms, make sure you get your PAP every 3 years if they do the HPV. Starting your mammograms at the age of 40. Okay. I see some smiles back here. Some of you do. Mammograms at the age of 40. Yearly if you have risk factors, and then or every 2 years if you don't. Getting a bone scan, that's what the DEXA stands for, either 50 or when you have menopause. Okay, and then a colonoscopy, see your GI doctor at the age of 50. We don't think about these things when we get older because we're so involved in our kids' lives, and I see that because I have 2 boys, and I forget things I need to do for myself. And then my kids they go to the dentist, they get their haircuts, everything. I don't think I've gotten a haircut in forever, and I definitely did not get my teeth this year. So I remind myself when I do these talks, I need to take care of myself too. So I just want to remind you that you're doing a wonderful thing for your kids, but you need to take care of yourself as well. Okay, so we'll take any questions now.
Yeah, sure.
Sorry, just want to make sure that everyone
And I would keep the question too, so.
Sorry.
That's the first question. Like school, it's
Can you hear me? Okay. Candy started around 10 or 11. When did you suggest that it doesn't have anything to do with whether or
that's a line.
So I'll answer my part, especially the pediatrician part. Before they decide to be active, is the best time. So that's the reason why we do it when they're in their pediatric years. The vaccine is available between 9 and 26. So I will continue to offer it if they have not finished the series. The HPV vaccine is 3 shots. So they get the 1 shot, and then 2 months later, then 6 months later. Right now, the vaccine has 9 strains that it does cover. The reason why it's so great, I'll tell you from I've just read these recent studies. HPV 16 and 18 used to cause 85% of all cervical cancer. Since the initiation of the vaccine, that has dropped to 70%. That is the most aggressive virus. So I do recommend it. What's great about our country, we're so lucky because cervical cancer it's barely top 10 for cancers for women. You go to a non-developed country, it is actually top 3. So we're really, really lucky to have pap smears and the HPV vaccine. This is what I see daily now, is HPV. I see it every day. So.
Yeah, it's also indicated for boys. So at so at the 11-year-old visit, so you got your baby vaccines for the Pediatrician Society, the baby vaccines, you have your pre-kinder, and then you have your before middle school shots. So at the 11-year-old visit is when I discussed HPV, meningitis vaccine, and your tetanus booster. So the CDC just came out with a new recommendation. If you get the HPV vaccine before the age of 15, you only need 2 out of the 3, because our immunogenicity, or basically the response that our patients have at a younger age, is better. Okay, so you get them 6 months apart, you only need 2 shots, which is awesome because it's hard to get you guys in the clinic when you're so busy with school. And I offer it to boys and girls at the same time. And that visit, we also do screening, blood work for before puberty, checking cholesterol, thyroid, all those things. It's a busy visit at 11 years of age, but I do recommend it before 15 because of the fact that we can cut down from one of them, and also because I'm already giving you your tetanus and your meningitis for school, so might as well give you the 3rd one, so you don't have to come back.
Who else is that? Did you?
Another question? Questions? Oh, I know somebody was saying.
Wait,
And you can just ask the question for.
Ooh, the question is, when you have a period, does it hurt? So I can hand it off to her. Usually what I say is that, yes, it can. And when I see you, usually when I see you, when we talk about it first, before the actual bleeding starts, sometimes you can get cramps in your belly, honey. So it's like you feel like you went running, but you didn't go running. And sometimes in your panties, you can get like white sticky stuff, but you didn't like accidentally go pee or anything like that. So those little things can happen before your actual period. But Dr. Chenkin will talk about cramps in the period today.
So, as Dr. Nala mentioned, you can have some cramping with your periods. And it's something that usually happens to a lot of women, and especially when you're first, because you don't know a lot what's going on. And the degree of cramping is different. So you might have a little bit of cramping, you might have a lot of cramping, okay? But it's important, once again, to let your mom or whoever know, okay? At home, if you're having a lot of bad cramps, because it's going to prevent you from doing stuff because it hurts, right? And there's things that you can take for it, okay? That can make the cramping go away, okay? If those over-the-counter treatment is not enough, so usually Advil, Midol is a big one. Usually making sure you stay well hydrated, being active, really does help. Heating pads, taking that rest, but actually resting is good when you're having the cramping, but if you're active before, usually the cramping is actually a lot less for a lot of girls, okay? But it can hurt, okay, and it feels like, so it can feel like, if you go running, you'll cramp. It's more usually in the center, but some girls even have sometimes back pain because it depends where their uterus is. So some just so you know that some women get cramping in the front, but some might have a little bit of like back pain in the back, and that's also considered pain from your period. So that's something that if you feel that, you can let your mom know that's happening. Okay, usually the cramping is worse at the beginning of your period. Okay, because your uterus, which is where your blood is coming from, is contracting. So when it contracts, it can cause pain. But it doesn't mean you don't have it, but if you do, there are things for you to do. So, but if it's the over-the-counter stuff is not enough, that's, once again, you come see us, and we can help you with that, okay? Because I totally understand. Sometimes you just need a little more, okay?
Yeah.
How long is the cramping?
How long is the cramping? So that varies, because just like how your period varies.
So we talk about on average, most girls have 3 to 5 day periods, and usually it's the first, sometimes like maybe a day or two, you might have cramping right before your period starts as your body's kind of getting ready. And then usually the first 2 days of your period are the worst times, but it doesn't mean you'll have it. Some girls might feel like, oh, I feel something rumbling, and they're fine. It's like amazing. They're like, wow, I didn't even know my period's about to start. But some girls, they have really bad cramping, and it's something that will keep them home from school, or they'll have to go to the nurse's office because they're having really bad cramping, and the nurse has to give them a Tylenol. Some girls actually gets really, they might get nauseated, things like that, but that's unusual. And if you do, especially if it's having month-to-month, if you have to go to the nurse's office, you're staying home and sleeping with that heating pad, come in and be seen. Like it's not, it's a new change. You want to make sure that, you bring yourself to ask those questions and make sure you're taken care of. Okay. Did I answer your question? Is there anything else you wanted to add? Okay.
On the next month will be on the same day.
The question was, when you have your period, will it be the same day the next month? Maybe. That's the answer. Maybe. So your period, you have it, you say every month, but it might be every 21 days. It might be every 28 days. It might be every 30 days. So if it is every 30 days, usually it's the same time every month, right? Because it's not 30 days a month. But sometimes some girls have it every 40 days. So it's very different. They have it every 5 weeks. So it does not mean it's the same time. The thing is, when your periods start getting regular, you'll notice that your periods are like, what, my periods are every 30 days exactly. You notice that pattern, give or take a couple of days. And that's usually a normal pattern for a lot of girls. But if you don't have regular periods, sometimes it's every 28 to 32 days for an average, So it is not a perfect science, but that's why we're going to talk about having things on hand as well with you, and we're going to actually give away some of these boxes. Okay.
We're both at red. Yeah.
The question was, how do you know when your period is about to start? So your first period is kind of hard to tell. So one of the things that we can gauge is if you start having breast development, and then you start having hair, so in your armpit or down there, your period should be coming shortly. So usually 2 to 3 years after your breast, the pubic hair is kind of variable, okay? But that's the reason why when that starts happening, we have this box here. It's called Hello Flow Box, which I think it was such a cute idea. And this box has all different things that a girl might need. So they come to this cute little bag here, okay? It's a little bag that looks like a pencil case. And what you do in this bag is you put a pad in here, hair ribbon. So they have a little, this is more like a maxi pad that's covered inside. And they have hair ties in here. They have candy, so it makes you feel better because you sugar baby, okay? It also has information, guides, everything. They have Kleenex, actually there's extra text here. But it's pretty much kind of nice to have a little pouch that nobody can leave you, and you have that in your backpack or somewhere. So if that does happen, you have that pad there ready. So, and then you can call your mom later, like, hey, this happened. Because what if it happens at school? You don't have your mom there with you, or like a teacher that you want to ask, and then you say, can I use the bathroom? And you're ready. It's kind of nice to have something of your own already. And I actually also say extra underwear, to have it here, and just in case, I know that's not easy, you can put extra underwear just in case something does happen. Started to put extra change of clothes, but that's something you might want to consider. Usually a lot of time happens is changes your gym clothes or something like that. But actually it's not. But it's kind of nice to have this. This is the boxes that we have, and it's just cute. It's such a cute idea for young girls to be prepared. I think that's the biggest thing, to understanding that this happens to every young girl, and just be prepared. Be knowledgeable, know your body.
Wear a pad and tampon every day.
Okay. Do you have to wear a pad or tampon every day? The answer is no, you don't. You don't. Only when you're on your period, which is usually about 3 to 5 days out of them. That's when you wear.
Okay?
How
How many cycles do you go through? A lot. I've never had this question. So, if on average you start your period at 12 and menopause at 50, on average, that's how many years? That's 38 years times 12. Who's good at math? So you go through a lot of cycles. You do. And then minus if you get pregnant, and minus if you have a regular cycle, and if you are on, medication that stops your period. So it's like, that's a very variable question. But it's something that you get used to. And yeah, I think that's the best answer. Like, I don't know, I'll let the moms answer. I think you get used to it. Yeah. But any other questions? Any questions from the lens about anything? You good? The question is, what is PMS? So premenstrual syndrome. So a lot of times, as you are going through puberty, and I'm not heading into social media too, so because she sees a lot of earlier stuff than me, and I see later on. So we talked about how you can have pain during your period, okay, or before your period. Sometimes you can have nausea. Sometimes right before your period, you might feel a little moody or angry or sad. All those feelings are normal, especially when you're young and you're not used to it. You might say, what is going on with me? Why am I so mad? Or everything seems like it's going wrong. It's okay. The reason why a lot of times that happens is because your hormones at that time are very, very high. Okay, your estrogen, your progesterone is at the peak, and at that time, when it's that high, sometimes your body is not in good control, and you get very labile. Meaning, your mood might go up, might go down. Somebody might say something, and it can be very upsetting to you. But that's okay. Okay, and during that time, a lot of times if you need to take a step back, it's not a problem. Okay, understanding that you might get angry, and your moms most likely went through something similar, to you, and they'll try to talk to you. Don't be angry with them because they don't understand you. They understand you more than you think. I can't emphasize how much I love my mom because my teenagers were awful, and it's something that you just have to go through, and I promise it gets better. However, if it doesn't get better, come see me or see her. Okay?
So we get that question a lot in varied forms, like, does puberty hurt or sad? And so PMS. So the way I like to describe it to the younger girls is that you might feel like you're really full, like your body is like full and your body hurts, even though you didn't go run or something like that. Your chest might actually too, right? So you were running in PE or something, and then it hurts up here. Your best friend said something, or your mom and dad said something to you, and for some reason you got really upset and cried, or you were fighting with your best friend, or you're fighting with your sibling. So those kinds of feelings are kind of part of what PMS is before the period happens. And so when this young lady had asked, when do you know when your period is coming? Sometimes your family might know before you do because you're acting differently. And that's okay. You can just keep it to ourselves and then just be aware that it's happening. But yeah, sometimes it's as simple as like you went to school. I'm so sorry. You went to school and you had a really bad day, and normally you do really well at school, and it's just out of character. That's usually what I see, at least. Sorry, I'll sit forward. It's not. 3,876 cycles. You are so bomb. That's awesome. Bravo. I believe you 100%. I don't need to do the math again. Put it in your head. You're fabulous. You're 12. You're a monster. You get extra cookies. Any other questions? Susan? I think we made excellent time. I'm gonna turn this off.